Welcome back to another episode with Bantering with ByrdAdatto. We've done almost a dozen videos and webinars in the last few months on safety needs to protect your business and practice from COVID in your facility. But what happens when COVID gets into your facility? To address these issues, we have a mini series we've put together for y'all, and we're calling it COVID Questions from Our Clients. So today's question is, Michael?
Today's question, Brad, is what happens if my patient refuses to wear a mask or have a medical reason preventing them from wearing a mask?
So this has been asked a few times because people who are looking at the CDC guidelines and they see the fact that if a patient's wearing a cloth, that helps them as a healthcare personnel from not having to quarantine themselves. And so they're getting some pushback from patients saying either the medical reason or I refuse to do it. So the first thing is depending on whether or not this person was still in a treatment plan that they have to be seen. So if it's elective service and you say that you have to wear a mask and the patient says I refuse to, then you get to choose whether or not you want to treat that patient. Do understand that we have had many staff members that are very uncomfortable if a patient comes into their facility without wearing a mask, and that they, as we can talk about in other episodes, can file complaints with OSHA so that you're exposing them to unnecessary risk. If in the event that the individual has a medical reason and you need to treat them, so maybe you had a surgery and they have to come back in for a follow-up visit, we always recommend to minimize the time spent with them but still maximize the standard of care, meaning that get that patient in the room as fast as possible with social distancing, get them in, treat the person as you would to be within the standard of care, and get them out, again, with minimum contact with your staff. So again, so you can minimize this person's potential exposure, because unfortunately we have to treat every patient as if they're asymptomatic. And so as you can see, there's a lot to unpack when it comes to COVID. There's so many different laws and regulations, but we're trying to answer each question as they come in. Hopefully throughout this mini series, we'll be answering a lot of your questions, but of course, if you have any other questions, just reach out to us. So thanks again for joining us today.